Hi, my name is Rebecca Johnson. I'm a first-year occupational therapy student at Midwestern University, and this video is to show my occupation-based kit for Analysis 1. This past year, I became an aunt to a beautiful baby girl named Kemper, who recently just turned 6 months. During this time of development, we are slowly introducing solid foods into her diet, so I thought this would be a great opportunity to present occupational therapy techniques into her development. Since you'll probably be on the move with your little baby, I put all the tools required in an occupational kit to feed an infant in this diaper bag so you can take it with you wherever you go. I purchased all the tools required at Target, but you can also find them at retailers such as Walmart or online and on Amazon. The items in the kit include a plastic plate, sippy cups, a food storage container, feeding spoons, wet one wipes, burp cloths and rags, bibs with a plastic backing, pureed peas, smashed bananas in a pouch that you can take with you, a real banana that you can mash, and yogurt chips for further development. The items in this kit are for an infant between the ages of 6 to 9 months. Depending on where they are, you can utilize the specific tools needed. Before I begin to explain each item in the infant feeding kit, I will explain the different occupational roles. The parent or the caregiver partakes in the IADL of caring for others in the act of child rearing and encouraging development. However, the infant will begin to learn and perform the BADL of feeding, swallowing, and eating as they begin to manipulate food within their mouth and practice the fine motor skills of bringing the food directly to their mouth. Additionally, there are many motor skills that the parent must have in order to perform this task, such as aligning, stabilizing, positioning, reaching, bending, grabbing, manipulating, and coordinating throughout the physical environment. Processing skills include things such as chooses, using, handling, continues, sequencing, terminating, and searches, gathers, and organizes to perform the task. Since your child is still developing, they are going to be able to practice certain motor and processing skills. Motor skills such as positioning, reaching, grabbing, and enduring as they eat their food, and processing skills such as attending, heating, uses, handles, and continues. Before the parent or the caregiver begins to engage in the activity of infant feeding, it is important to create the proper physical environment for the child. It is important to have a supportive high chair with a proper back support, because in this stage, the child will be able to partially hold themselves in an upright position, but might require a small amount of assistance. The chair should also have a small tray in front of them, which can further support them and make them feel very comfortable. It is also a good idea to free the physical environment of too many distractions so the infant can focus solely on the activity. To start the process to feed your child, you want to prepare all the meals beforehand to create a smooth flow of the activity. You can use the pureed peas, which are already made and in a reasonable amount, or you can use your own banana and smash it in a separate bowl using the container. Once the food is prepared, you can use the bib and securely fasten this around your baby's neck, making sure it's not too tight. These bibs with the plastic lining in the back are great for preventing any further mess. You also want to have any burp cloths and wet ones handy, just in case things get a little messy. When introducing new foods to your child, you want to start with something very simple, like a pureed vegetable. You can start with the pureed peas using the feeding spoons to make the process as easy as possible. Once your child gets used to the consistency of the pureed peas or a different vegetable, you can then move forward and try a banana, which you can smash up will have a slightly thicker consistency. It's very important to start to introduce new foods to your child's diet in a very slow manner and allow your baby to acclimate to the different textures and the different tastes of each food. Your child might have a difficult time getting used to the different textures or even having different textures in their mouth. I have also provided a sample of textured spoons that you can order on Amazon to help further the development of your child and to help them acclimate to the different textures. Further in their development, you can also incorporate the yogurt chips, which are very handy because they melt in their mouth, so they doesn't require them to chew, but it will also help them to practice their fine motor skills. You can take a few of the yogurt chips and place them on the plastic plate or the tray in front of them, and they will have to practice their fine motor skills in grabbing, reaching, and manipulating the food in order to bring it to their mouth. As your child continues to develop, you can also use the food storage container to separate different foods for your child so they can have different textures, different tastes of a variety of foods that they enjoy. And depending on the development of your child, a little past the age of 6 to 7 or 8 months, your child can also start using a sippy cup. At first, it might be hard to make the transition between a bottle and a sippy cup, so there are certain techniques that you can use to make that transition a little bit easier. You will know that your child is ready for the sippy cup when they can successfully hold themselves up in the high chair and they are being spoon-fed pretty easily. The first thing that you can do to introduce the sippy cup is to demonstrate yourself. So actually hold on to it and demonstrate to your child what to do so they can observe your actions and follow. If your child is still not receptive to the actual apparatus, you can try using a straw, which would be an easier technique that they are used to using with the sucking motion that they're used to with the bottle. Most importantly, this should be an experience that is fun for the child and the parent. Try things like encouraging the child to eat with the family at specific meal times and beginning to introduce the idea of routine and habits to the child. So that is my occupation-based kit for introducing solid foods to your child. I now have a small clip of a very practical video to show you how this is implemented. Thank you for watching.
Okay, we have our food already mixed. Are you ready, Kemper? Ready for a bite? Yeah. You get a spoon. Good girl. Good girl, Kemp. Does that taste good? That tastes good? Good girl. Oh, that tastes so good, huh? That tastes good.